Enko ahomane so emrada mene Ora Frank Toblu enkodi enkomo emra wono general secretary edema Private Health Facilities Association na mene no eni enkomo. Frank Otimeka, good morning.
Good morning, Mr. Okapa.
Eradi adom na endra ye from baby na wo de na so marketplace de pa ne ente nkaye bibi a fine.
I was looking for money for my members.
I see. I can understand. Over the weekend, there's a lot of conversation I'm having here. Now, majority of it, and then the except you take it away in that Jumedi particular was the fact that buying especially with the National Health Insurance Scheme. Say amamu health facilities are more accepted the health insurance card. Now claims are making as private institutions. Na modi akwa jimusika wa buy hono for close to 4 to 9 months ni aban to amu claims no you raise other concerns in so a mo be hwe ni mo say scheme no National Health Insurance Authority no ebetimi address enya sade a we will get to a point amu be withdraw mo services ma me entio na yenya asem ni mo entiase ye.
All right, another media over your network. Now, yes, I'm said, you see, I buy a car over $150 million and that has to do with the claim I submitted within the period of 4 to 9 months.
Okay.
And I come back when we submit our claims, it is expected, we said, within a period of 3 months, they should be able to pay the amount. But the America say that is not even the case. And we have come to realize that the National Health Insurance Authority as an institution and we don't even have the money on the now Honorable Akando, minority ranking member on health. Like I said, I buy 2 billion Ghana cedis for the period in question. And the total amount Ministry of Finance, National Health Insurance, 127 million. After 1 billion 800 and something million Ghana cedis. Now the question is where is that money? How is that money accounted for? Now, before the introduction of National Health Insurance in this country, President Kufuor at that time was saying, where do we get money to support this program? Then we have to look for money at SMIC, where they have taken 2.5% of every worker in this country to support National Health Insurance levy. And that is one source of revenue. The second source of revenue, 2.5 health insurance levy, which everybody pays, including you in the studio and myself and brothers and everybody who consumes products on which this levy is imposed. Very good. Now, the National Health Insurance levy has been able to accumulate over 2 billion Ghana cedis for the national. But that money is not seen in the account of National Health Insurance levy. And that is the reason why National Health Insurance Authority is unable to pay the providers for the services they have rendered to the generality of people in this country. Now, that is on the one side of the second side of it. We have come to realize that our own investigation is that the money is being transferred to free SHS.
No, but that is a serious allegation because
it isn't an allegation. It isn't.
Yes, but what is your substance of evidence?
Very good. In accounting practice, you will be there in an environment. Environment means that there is an approved expenditure to be incurred. Ministry of Health, Ministry of Finance, Ministry of Education, Ministry of whatever you can mention. Now, when these monies are allocated to these sectors of the economy, and then one sector is not having money, there is, like I said earlier, we have something called environment. Environment, NHIS, you can take money from one segment to another segment, and then when there is funds in the future, you can refund that money to that particular sector. And that environment is going on, which is affecting the National Health Insurance Authority. So I am not making an allegation. This is not an allegation.
Maybe Richard, that is a complete explanation about which we know, sir, in terms of governance and in terms of administration, that is allowed. But we are clearly told by the government and its policies, sir, the free SHS is funded by proceeds from our oil. Piako for reporter, year on, year by year. They tell you how much the oil revenue spending in terms of expenditure with the free SHS.
Oil revenue.
Yes. How do you make such a claim? Said the proceeds are a free NHIS living in more bano. They fund it and now divert Sikano and they both free SHS honka. How do we make such a claim?
To other sectors of the economy. Now, and if the 2.2 billion Ghana cedis, which is received in respect of national health insurance through the National Health Insurance Levy, is not transferred to the National Health Insurance Authority, but only 127 million. Now, that 127 million, if you take it out from the 2 billion, you are left with over 1.something billion Ghana cedis. If it is not directed to some other sectors of the economy, then where is that money? If indeed you are telling me that they have not used that money for any other sector of the economy, then it means that that money must be in the account of National Health Insurance Authority, which must be used to pay the providers' claims. This is a clear fact that I'm talking to. Are you getting the argument? So if this money, please hold on. This is a serious issue. This is a serious governance issue. Now, if it is not accounted for, then it means that somebody is using that money for his personal interest. Unless government is able to tell us that, fine, we have received this amount of money, for the fact that we have something called environment, the governance system, we have used it to do X, Y, Z. And for that matter, we cannot pay our money. It is well understood. But if you are telling me that that money is not used for anything, then what is the reason why you are not paying the health service providers in this country? What is the reason?
Richard, yes, if
the money is there, where is it?
Let's take the issues one after the other. I understand clearly the point you are making, but I'm saying, sir, you are the general secretary of your association. You might have done a research, search revelation with the Tudra Anope. But my point is that, okay, on which account are we saying this? I cannot say, sir, in terms of governance. But you equally do not have a substantive evidence to buttress the point you are making. To the extent, say, we be making claims, say, Sikano are being used for free SHS. And you know, what evidence do you have to that effect? That is what I'm simply asking for.
You see, to the other sectors of the economy, a complete statement.
Do you have any evidence in that effect?
Senior.
Richard Mitiopa.
You see, there are sometimes we try to belittle the major points of discussion. Now, Sayayi and Freeman, let's go to the straight matter. Where is
so you're making it clear, sir. It was just a statement. You were just casting an insinuation because I wanted a concrete evidence, sir. If I'm to call the deputy finance minister or the finance minister himself, I'll be able to put it to him. Say, this is the claim. Sika eye levies are a free NHIS living in more urban. Mumfama facilities are running the health program. Okay, now more diverted Sikano to other sectors, which includes so and this is the evidence. Then we know,
yes,
sir, we can situate the argument.
The fact is, we are making the allegation against them. They should come and prove that. They should prove otherwise. We haven't used that money. If they prove that they haven't used the money for XYZ, then they should tell us where the money has been spent. We are making the allegation that our money is being used to finance other sectors of the economy. And that is why the hospitals, clinics, and the maternity homes in this country are not paid for the services they are rendering to the generality of people in this country. And that is the issue I'm talking to.
I see.
Can we continue with the substantive
matter?
Very good. Actually, we are saying that we are going to withdraw services to the National Health Insurance Authority. We are not going to give them services anymore. That is what we said at our press conference. Now, we also talk about partial withdrawal of services. As the Wuko Hospital here, now, the law mandates us to provide essential services. Essential services needed. Excuse me to say that being an accident at the hospital unconscious. It is mandatory and required by law. Third, such a person should be attended to with all necessary apparatus available at the disposal of the medical practitioner in the hospital. Alright? Now, we also need to have essential medicines. Some medicines, when somebody is in dire need of it, you make it available so that the person can be resuscitated. The question is, where is the fund to procure these medicines? Anyhow. So if you come to the hospital, these funds, the funds are not available to support this situation. How do you survive? You cannot survive. And don't you know, you see the Uber hospital, so that we can get this medicine to solve your problem. Now, on the National Health Insurance list, there are drugs. You call it generic products. That generic products, it is mandatory to say, Uber, we have to give it to you free. But we are going to stock branded products now. That branded products, any health insurance list knows. And when you come, she said, one don't get it.
I see.
But, you won't get it. And nobody can take us on because branded products are not on the health insurance list. So if the clinician, in his own wisdom, a clinical diagnosis, realize that it is a branded product that can solve the patient problem, so be it. And it is allowed by law. It is allowed by medical practice. And yet
Richard, across the country, private health facilities are more providing services to the National Health Insurance Scheme.
Now, what the way most of things are not me. I said they responded to. I
No, I understand. No, not in that context. Richard,
I always don't want to answer.
Richard, I'm coming. Maybe I'm not playing answer. My question is harmless. Now the point is that if the claims are not being paid, okay, now membership no air withdraw services. We should be able to know the number of facilities people are going to deal with, so that who call hospital wouldn't him say definitely no, you'd have to carry something on your own self and say what to be the services, and see you should be able to help us with the
very well. We are talking about 600 facilities
across the country.
Yes, we're talking about we are located at very strategic points and providing services with a huge turnover of a facility without less than
I see. There's a radio feedback me I don't know.
Because I'm in a vehicle coming to town.
All right, your best answer for to get a better sound.
That is fine when I get a better one.
Okay. Thank you very much. Many Ora, Frank Toblu, Richard, one of your General Secretary at the Private Health Facilities Association of Ghana, and many a day in common. But